welcome. My name is Augusto Bastidas, and today is my pleasure to introduce Gloria Wu, producer for our show Health Talk. Welcome, Gloria.
Oh, thank you for having me and interviewing me.
It's a pleasure to have you today. We're going to be discussing diabetes and eye disease. But before we get started, I want to give some background on Dr. Wu. Dr. Wu is an ophthalmologist in Los Gatos, California. She's a East Coast product, having been in California now just a few years. And she is a subspecialized ophthalmologist with an interest in retina surgery. Is that correct?
Yes.
And could you tell us a little bit about the training that you've gone through and how you've gotten to California and now to produce the Health Talk?
Oh, well, I was in the East Coast for 18 years, and I was at Harvard Medical School teaching for about 4 years. Then I was in private practice, also associated with Harvard Medical School. And I came here because my husband decided to go to Stanford and be chief of electrophysiology at Stanford. And so, lo and behold, I relocated myself to sunny Los Gatos, and I'm having a great time. But a little bit about my training. I was an East Coast product. First, I was born in Cuba, and then after that, I came to America, and I grew up in Chicago, and then I grew up in New York City. I went to Harvard undergraduate, Columbia for medical school, and I did general surgery 1 year at Mount Sinai, Cornell for ophthalmology, and back to Harvard and Harvard Medical School for retina, which was 2 years. So to be an ophthalmologist, you do 4 years of medical school, so we're different from optometrists in that optometrists go to undergraduate college and then optometry school, and then they stop. We go through undergraduate college, go to medical school, then we do residency, which in my case was ophthalmology, where we learn to operate on the eye, and then I did 2 more years of subspecialized training in retina and vitreous disease, where we learn to operate on the back of the eye. So a subspecialist in ophthalmology means that you had extra training beyond the basic of ophthalmology residency. So we're the eye surgeons and eye physicians. We're the ones that do the laser surgery and the actual surgery of the eye.
Quite a specialized area.
Yeah, for 350 microns.
So could you tell us a little bit about what the retina is? I see you have an eyeball with you.
Oh, here is the eye. And as we can see, we can open up the eye like this on television. The front part of the eye is the cornea. The cornea is where people do LASIK surgery to get better vision. And this is what people do. They throw out their glasses and they had surgery. And so if we remove the cornea, the next part is the lens. And this is usually optically clear when you're young, up to age 40. And as we have more birthdays, it becomes yellow and then becomes opaque white. So this part, this cataract, would then be removed and a new plastic implant would be placed in this area. Now,
so that's the common operation of cataract surgery.
Right, and all general ophthalmologists do that. So when most people say they go to their ophthalmologist and having eye surgery, they're having cataract surgery. And that surgery is 98% successful in America. So we're very proud of that statistic because we've helped many, many people see. And we're very pleased.
Can we go back to the cornea for a second? Could you just comment? I understand the cornea is transplantable.
Yes, this cornea has no vascularization. So in a way, it is a type of tissue that is easy to transplant because you have less possibility for rejection. There is possibility for rejection at the edge, where the blood vessels are. So
a cornea transplant can help someone that's injured their cornea and the light can't go through.
Yes.
And so that would be a very valuable resource for patients and families considering tissue transplant.
Yes, and also organ donations. What happens in that people who are born with certain abnormal corneas or people who get corneal disease late in life, severe infection in the cornea, overwearing their contact lenses, having a very bad infection, and they have a scar. So instead of being clear, optically clear, like the top part of your watch, it becomes opaque, and then they take out a part of the cornea, like a round part, and they put in the donor cornea right there, and they sew it right into place. And the entire process of the corneal transplant, which will take maybe perhaps 1 to 2 hours, but the healing process will take about 6 months for this cornea to really be accepted.
Now, you specialize in the back of the eye, so what's in the back of the eye?
So here's the eye, and the back of the eye is the inside lining, like the film inside the camera. So this tissue, the retina, is both vascular and nervous tissue, so it has nerves and blood vessels. It's highly vascularized, so it's really clear and transparent, but the reason why it looks orange is it reflects all the blood vessels underneath.
So the retina, the back surface of the eye, is like the film in a camera.
Exactly.
And then you have the cornea and the lens that projects the image onto the retina.
Yes.
And then the retina has a lot of nerves, which then
go through the optic nerve and then are connected to the brain.
Okay.
So you have to have ability to see not only just the retina, but the cornea and the lens. Everything has to work in this organ.
So today we want to talk about diabetes.
Yes.
How is it that diabetes will affect the eye?
Well, in diabetes, it affects the smallest blood vessels and affects vascular cells. So if you have too much sugar in your blood, it kills off cells. First, the vascular endothelial cells or endothelial cells. And what happens if you take tissue culture, just take a petri dish and have tissue culture, and you put in the tissue culture glucose, the concentration more than 100 milligrams per deciliter, more than what's normal, the endothelial cells will die in this tissue culture. So too much, the high concentration of glucose in itself is toxic to the blood vessel cells. So because the retina is so vascularized, these cells die. So imagine a pipe being a blood vessel, and if the cells outside the pipe, if those cells die, you have holes. Then the pipe will leak, and it will not carry the nutrients and the oxygen to the desired place, desired part of the retina.
So patients with diabetes
yes.
have high sugar levels
yes.
if they're not treated.
Yes.
And then the high sugar level will directly injure the blood vessels, including the blood vessels in the back of the eye.
Correct. Once there is holes in the pipe where you don't get enough blood to the area that needs oxygen or nutrients, that area dies. So then you have ischemia. You have no oxygen. So dead tissue will then mean that that area of dead tissue will not be able to see with that part of the retina.
So patients lose vision.
Exactly. So what happens that if you look at this retina, now part of this retina is called the macula. So if we're standing right here on this rug could be considered the macula, and the room is the eye. The walls of the room would be the rest of the retina, but the part that does the seeing would be this rug, which gives us 20/20 vision. So
So when we read,
yes,
we're